We can be very proud that we are prioritizing the far north as the first part of the province to receive the Moderna vaccine, both because it's easy to transport to remote locations. They're both equally effective, and also because the active case rate and the test positive rates have been highest in the far north. So I think this shows that it's a combination of logistics, but also need in terms of epidemiological data store. And initially this will be going to the far north central and far northwest parts of the province. This is where we've had high number of cases.
We also received our first batch of Moderna vaccines in Saskatchewan just last week. Yesterday we began administering those vaccines in northern Saskatchewan. We are continuing to deliver these vaccines to the 3 far north regions as well as the northeast region. In the northeast, vaccines will be sent to Melfort. The priority groups will be the same, ensuring that frontline healthcare workers, residents, and staff of long-term care and personal care homes receive immunization first.
We have Dan Jones with NBC.
Yeah, last week, Minister, in your presentation, you said that there were 4,900 Moderna vaccines destined for the far northwest and the north central regions, and that really the far northeast was being excluded. And in today's presentation, you say as of December 28th, 1,450 approximate doses of Moderna are headed to the far northeast. What has changed from 7 days ago to today?
This week, let's find out. So before we get into this week's issues, it's really important to set out the context of how our neighbors are handling their vaccine rollout. In Alberta, they really aren't vaccinating members of the public until next month in February, including seniors, their First Nation citizens, and people living in the north or remotely. Next door, in Manitoba, they really just released their vaccine rollout plan yesterday on January 6th, and received some criticism for this late policy. However, Manitoba will be delivering 5,300 doses of their original shipment to First Nations communities. So, all things considered, Saskatchewan really is doing quite well with its vaccine rollout. A staggered plan that will not see mass vaccinations until fall of this year, 2021.
Thanks again for joining us today. Again, in the Legislative Building in Regina, we have Minister of Health Paul Merriman and Dr. Saqib Shahab. Joining us on the phone line is SHA CEO Scott Livingstone. Both the Minister and the Doctor will have opening remarks, followed by time for questions.
The initial vaccination program started December 15th, so we're just finishing our second week, and 1,834 vaccines have been administered. Obviously, healthcare workers providing ongoing regular care to COVID-19 patients, staff who work in long-term care facilities and personal care homes, and residents will be vaccinated in Prince Albert starting next week. So all good news in terms of the Pfizer vaccines.
In terms of Moderna, the Minister of Health, Honourable Paul Merriman, stressed that Saskatchewan needed more accuracy for what they could expect in shipments.
While our vaccination program has been going well so far, these are still relatively small numbers of vaccines that we have received from the federal government. We expect the federal government to begin receiving and distributing much larger numbers of vaccines early in the new year. We are trying to get a clear indication from the federal government of the number of vaccines they will be sending us each week, so we can better plan for the next steps in our distribution process.
This vaccine requires -20 storage, so easier to move and store. And initially, this will be going to the far north central and far northwest parts of the province. This is where we've had high number of cases and high test positivity rate. And then initially, about half the doses will be sent and distributed. Again, the redistribution is quite complex in the far north, so all of that has been worked out, and that will start this week and next week. And then as the vaccines are used, further shipments will be sent from Regina to the far north. So the weeks of January 4th and 11th, vaccination with the Moderna should commence. And again, the priority will be on populations at high risk, including long-term care residents and staff, personal care home residents and staff, and frontline healthcare workers providing ongoing regular care to persons with COVID-19, as well as staff working in COVID-19 testing and assessment sites.
And again, this isn't a very densely populated area. The population is spread out in the north, central, the northwest, and the northeast. So when we're doing that, it's not as if there's a lot of individuals that are there right now, certainly that are meeting our first order of sequence, which are long-term care residents, people that are over 50, healthcare workers. There's not the volume up there that there would be in the larger centers. So.
And here's a bit of data just to show what the minister is talking about. Of course, the cities have a larger population than the municipalities, and of course have more health professionals. This is the same data, just organized in a different way without the cities, so you can see how the north is broken up. The northwest is about more or equal to half the population. But if we look at the active case numbers recently, the north is no longer equal. And if we move this data to a per capita basis, the results are even more troubling. And this is what caused leaders in the tri communities and the far northeast in general to have some resistance to these announcements.
We have Dan Jones with NBC.
Yeah, good afternoon, Minister. The Ronge Indian Band Chief, Tammy Cook-Searson, has expressed concern about the rollout of the first allotment of the Moderna vaccine, saying that she wasn't consulted and neither were local medical officers of health. So why hasn't the province been in touch last week with local leadership about how this rollout will happen?
Without a seat at the table or being notified of when rollout could be expected in the far northeast, our leaders were worried that we may have to wait until phase 2 in April 2021.
Especially starting April, and that's when I think there'll be broader supply, and that's when the vaccine will be opened up to younger age groups and with underlying health conditions initially, and then to the general population. I would estimate June, July onwards.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
Hi. I'm just wondering, how have you, or if the plans aren't set yet, how will you determine where the doses get sent first and how many, especially because Moderna is a little bit more travelable, I guess, than Pfizer? Like, why one community over another, or why one long-term care home over another?
Yeah, I think that's really important question in terms of sequencing by need. So obviously we only have enough vaccine for persons in long-term care facilities, personal care homes, persons 80 and older initially, and specific healthcare providers who are looking after COVID patients. In terms of where it goes, as we know, Pfizer requires -70 ultra-low temperature freezers. Initially it came to Regina, stayed in Regina. Second shipment came to Saskatoon, stayed in Saskatoon for local vaccination. Third shipment is coming to Prince Albert, will stay in Prince Albert for local vaccination. And as we have more ultra-low temperature freezers deployed, the Moderna vaccine will go primarily to hubs that can support the Pfizer vaccine.
If you were following along, you just heard Dr. Shahab say that the Moderna vaccine would be primarily initially supplied to those locations that could support the Pfizer vaccine, despite the two drugs' very different needs. As well, in the Saskatchewan government's December vaccine rollout document, they did note that regular freezers would work for Moderna's storage in the province. Considering vaccination is touted as the key to Saskatchewan's return to normal, members of the far northeast region were left scratching their head about why there wasn't more equitable division of the Moderna vaccine, especially considering we had past outbreaks in the region and we're continuing to experience new ones. On January 4th, Ronge Indian Band Chief Tammy Cook-Searson, together with the Northern Intertribal Health Authority, or NITHA, declared an outbreak in Stanley Mission, north of Ronge. Just a day later, Another outbreak was released by those same entities for the Kitsaki Reserve near Ronge, Saskatchewan. In speaking with MBC, Mayor Baschuk of the northern village of Ronge said that it made, quote, "zero sense to me how we are not included in the January 4th and 11th allotments. It is my hope that our tri-community leadership letter that identifies our united concerns will be recognized by the Minister of Health and provincial government, which will result in timely answers. My intent of putting pressure on Minister Merriman and Premier Moe is to recognize the Far North entity is of great importance, which not only meet the outlined criteria for receiving Moderna vaccines, but that the East Zone also face isolation concerns." Thanks to the quick actions of our elected leaders, like Chief Tammy Cook-Searson, Mayors Baschuk and Ratushniak, a more equitable division of the Moderna vaccine among different northern regions was reached, one that is more reflective of the case numbers in each of those regions, populations, and outbreaks. Still, more work is to be done, with Minister Merriman and Scott Moe saying they will meet with federal ministers, including Prime Minister Justin Trudeau, to get more concrete numbers for expected vaccines.
Here in Saskatchewan, we are getting the vaccine into people's arms as quickly, safely, and effectively as possible. But we are limited by the number of doses that we have received. We could get absolutely more vaccinations done more quickly if and when the federal government provides us with more doses. As of right now, the federal government is telling us to expect about 6,800 Pfizer doses a week in the last 3 weeks in January, and one more shipment of 5,300 Moderna doses. That's a total of 30,000 doses expected in January. This is just simply not near enough. I can tell you that the 4,900 Moderna have been shipped out of Regina, and they're either in transport to specific locations or they're on locations getting ready to administrate to people. So it does take time to do this. This isn't a quick process, and we want to make sure that we keep the vaccines safe while they're traveling.